The recommended summary plan for emergency care and treatment, or ReSPECT as it's known, is a process through which people can describe the kind of clinical care that they would want. Staff can then use this plan at a time when patients may not be able to describe what they want or communicate their wishes.
We are intending to implement ReSPECT from April. It's a top priority for the Trust. The Trust Board is fully sighted on it and is very keen that it will be implemented on time and will improve the care for our patients. Implementation of the ReSPECT form is a key project of the STP as well as nationally, and we are the first trust locally to be implementing it, which was excellent for us. Alongside the ReSPECT form, we're also implementing a treatment escalation plan which will improve the decision making around care that we give our patients and will allow some of the junior medical staff, in combination with senior consultants, to make decisions about just how far patients want to go, whether they would want to go to ITU, have renal replacement therapy, or would be happier with ward-based care, or of course are nearing end of life and would like end of life care. So as part of the whole process, we are reviewing the way that we assess patients, and this can only be good for treatment going forward.
ReSPECT is a process, and it's a recommended summary plan of emergency care and treatment for people should they experience a medical emergency. It very much documents the person's preferences and wishes for how they would want to be treated in such a situation, and it's very much a balance between people's wishes, preferences and clinical judgment. It's very much a summary, and it very much draws on any previous advanced care plans or treatment plans that might be in existence. So for example, a person may have worked with their GP and putting together an advanced care plan. A nursing home resident may have a peace plan with their wishes documented there. The ReSPECT plan and process is very important because very often people who experience the need for emergency care and treatment may actually lack the capacity at that point to participate in the decision making, and certainly clinically. So the person may be unconscious, or they may lack the mental capacity to be involved in those decisions.
One of the many benefits of ReSPECT is that it enables us to decide what we can do for the patient as opposed to what we classically won't do for the patient. And ReSPECT will marry into the treatment escalation plan form, or the TEP form as it will be known.
I think it's important to remember that ReSPECT is a process, not a form. What I would like to see happen on the back of this is a change in culture, and that every doctor and senior nurse embeds into their basic day-to-day practice, asking the patient, what's most important to you right now? We need to understand the whole aspects of advanced care planning. We need to be confident in saying, have you made any decisions about your future care?
I'm Molly, I'm a patient, and I have a ReSPECT form and an advanced care plan. Well, it's been a fantastic process because I've been able to express what I want, and I feel that through those conversations I've had a better sense of what I want. I've been lucky, I've had time on my hands a little bit. I lived a little bit longer than I expected. I do have an illness. What I loved about the ReSPECT process and form was that other things had happened, and so there was a kind of need to feel that was firmer, and I feel that it's firmer because it's a good summary of all those things.
As a clinician using ReSPECT, I found it incredibly empowering for myself to help conversations, but also for the patients to feel valued and for the patients to feel they're contributing to their decision making. It is a challenge if you're not used to involving patients naturally through your consultation style, but as doctors and senior nurses, it's something we should all be doing naturally.
I think from a nursing point of view, the ReSPECT process is really important because it allows us to advocate on a patient's behalf, and that's quite powerful. So by determining somebody's wishes and preferences for care, and that could be from sustaining life treatment to more of a palliative sort of comfort care approach to emergency treatments, then we can actually speak on their behalf should they lack the capacity to do that.
the ReSPECT process does help us if we are using the question, what's most important to you right now, within our normal consultation skills. It will then guide us. Are we now ready to make a plan for the future?
I think a lot of patients I know would appreciate more straightforward conversations. There's something about valuing my view and what I want and hope for, and I suppose a kind of collaborative relationship where my doctor and I work together and we're trying to sort it in a way that's going to be good for me. And there's something about just giving that little bit of extra space, not necessarily time, I don't think. The important thing is to create an environment with a patient, from my perspective as a patient, where there can be some honesty on both sides about what the fears are, what the hopes are, what the possibilities are, and then in my case, what happens if we do nothing? Because that's another option.
On section 3 of the ReSPECT form is an area where patients are able to identify their priorities. This line's called the continuum, and the feedback we've had so far is that patients, like the visual aid, it gives them to place where they are on their journey within palliative care.
Asking the patient what's more important to them, if you think of the continuum on quality of life versus quantity of life, in the majority of cases people often will have a view. Sometimes people aren't sure, but it starts the conversation honestly about moving forward.
I loved the continuum because then I was able to say, this is where I am, just in case anyone's in any doubt, this is where I am. So even though I'd done all that other stuff, that was lovely to see in that way.
I'm Sophie. My mother had a terminal illness called PSP, and she died sadly about 6 weeks ago, and she had a ReSPECT form. So when Mum was first diagnosed, she didn't really want to talk about end of life. But I guess as she realised she was getting more sick, she was very, I think it was preying on her mind a lot about what would happen to her, and that she wanted to be in control and in charge of her medical care right the way to the end. So we got involved with the hospice, and Dr. Barclay came along and talked to my mother about filling in a ReSPECT form. She was on a slow slope down, but then actually her death happened very quickly and really quite unexpectedly. The district nurses arrived. They said, we think we should take her into hospital for some tests. And because I knew about the ReSPECT form, because we'd all been part of it, I was very confident and comfortable being able to say it's actually my mother's views, and I am being true to I'm being my mother's advocate here because my mother can't speak. And that ReSPECT form gave me the confidence to do that. So actually I'd say, and I'll try and say this without crying, but it's quite hard, I'd say the last 7 days of my mother's life were absolutely the death that she would have wanted. She was at home, she was in her bed, she was in her own nightie, she was with all of us around her. She wasn't, she had she was connected up to some morphine, but that was it. And we all knew that was really important for my mother. So it was lovely that ReSPECT form allowed us to do that. And
As part of the basic life support mandatory training sessions, we've been running an awareness session on ReSPECT. This includes the element of DNA CPR, but it's important to remember that ReSPECT is more than just a DNA CPR form, and you can have a patient who has a ReSPECT form and is for resuscitation.
When you undertake a ReSPECT process conversation, which is going to include a recommendation about resuscitation, still be aware of the decision-making framework from the Resus committee, and still be aware of what the success rates are.
I think the easiest way of thinking about this is by looking at 3 broad scenarios that you might encounter within the hospital. The first is the patient who comes into the A&E with a ReSPECT form already completed. Under those circumstances, you should review that form, and if it remains valid, then sign the form at section 9 in the usual way. Another possible scenario is the patient that comes into hospital without a ReSPECT form but is acutely unwell, and that patient may well be appropriate for a treatment escalation plan. The Treatment escalation plan, or TEP, provides rather more detailed description of how to manage the patient in the event of a medical deterioration. So it's quite possible that an acute patient of that sort might have both a ReSPECT and a TEP form. Now, since most of the medical details will be recorded on the TEP form, it's probably reasonable to complete the ReSPECT form with the minimum of details, possibly just referring to the TEP form. It's worth bearing in mind that the treatment escalation plan is only designed for use within the trust. So for patients discharged home, then a ReSPECT form would have to be completed properly at the time of hospital discharge. The third scenario would be the case where a patient comes into hospital with an acute illness, but they don't have a ReSPECT form in place, but they do have long-term health issues, or might just want to discuss the issues that we would expect to discuss in relation to a ReSPECT form. Quite often this sort of patients are going to be quite unwell. You won't really have much time to discuss in detail what their wishes are. So it's quite reasonable initially to fill the form in quite rapidly, maybe discussing acute issues such as resuscitation decisions, and whether or not, for instance, the patient might be admitted to ITU in the event of a deterioration. It should be possible to complete that discussion in a matter of 10 to 15 minutes. So you don't have to spend a great deal of time filling out a ReSPECT form in an emergency situation. During the patient's hospital stay, as their condition develops, as they respond to treatment or fail to respond to treatment, it would be reasonable to have a more detailed ReSPECT conversation later on, and perhaps to develop the form or even to replace it with a new form.
At the moment, we're focusing on completing the ReSPECT form with the patient, and they keep this as a paper form, which they then take with them and then share with their GP, paramedics and other healthcare professionals. We look forward to the future when this form will be saved electronically and shared more easily.
In the community, we've been doing care plans for years, and now we have the opportunity to match in with the national scheme of ReSPECT. So when I enter a care plan here on my computer in the surgery, I can complete an electronic ReSPECT form, and as long as I've asked for permission, that can automatically be shared through the summary care record with enhanced information. If that person ends up on accident emergency or MAU, they should, at a click of a button, be able to see this information and then be able to follow through with what it says.
We will receive ReSPECT forms in an electronic copy from many different places, from GP surgeries, from nurses out in the community, or from the hospice, and we upload them to our bespoke record keeping system electronically called IBIS, which keeps all of our patient information, and it means that crews can download that information directly to iPads in either the ambulance or the patient's home, and that's really important for us to have that really quick, instant access to the information that we need in an emergency.
To follow on from the mandatory training sessions, there are online resources at respectprocess.org, and this enables you to complete a variety of modules, and you can print a certificate at the end for your PDR.
The palliative care team in the hospitals and in the community and various other people are there to support all our staff in East Sussex Healthcare Trust to make sure this is a successful rollout of this, what I feel, fantastic process.
The death that we were able to give my mother was the one that she wanted. Death, is that the right word? But that, you know, her last few days on this earth were as she would have wanted them.
Living life and the end of one's life the way you want, well, you can't have anything better than that.